Hello, I'm Ged Stilliard from Thompsons Solicitors, and I've been asked by the POA to speak to you for a couple of minutes about COVID-19 personal injury claims. I'm going to talk a little bit about the practicalities of bringing a PI claim for COVID-19, just describe the legal principles, and then give you a little bit of an update as to where we are with the current position on making these claims. So firstly, in terms of the principles, we've seen hundreds of these inquiries from a variety of unions and non-union members. And we've seen them from people who have recovered reasonably quickly, to people unfortunately suffering from what's become known as long COVID with prolonged symptoms. And then also we've seen a number of, sadly, of fatal claims where people haven't survived the illness. So it's perfectly possible to bring a claim against your employer for the contraction of COVID, but that's not to say that it's going to be easy to win these claims at all, and certainly nobody has done that yet to our knowledge. For POA members specifically, we've seen relatively small numbers of claims so far, and that's maybe a little bit surprising because we're aware that lots of members have contracted COVID, and we believe that in at least some of those cases you may well have contracted the condition at work, and that your employers may have been at fault for that. So the first thing to say is that we do need to show, in order to bring a successful personal injury claim, we need to show that your employers have been at fault in some way. It isn't enough for us to show purely that you have contracted the condition at work. But that is one of the elements that we do need to prove. So we need to show, as lawyers say, on the balance of probabilities, in other words, it's more likely than not that you contracted the condition at work. There's another step in a personal injury claim, which is to say that we must show that it was reasonably foreseeable that you would have contracted the condition. But I think in the circumstances of COVID, that's unlikely to be a big problem. So in terms of the practicalities, we're obviously aware that POA members work in a variety of different workplaces, both in prisons and in other workplaces, and indeed the prisons are, differ greatly. Working in an open prison, for instance, is going to be a different scenario for the employer trying to create a proper risk assessment on COVID to the position in a closed prison. And a high security prison may well have different considerations again. So in some workplaces, the employers, and some parts of workplaces, the employers are going to know that they're exposing you to COVID-19. For instance, in the healthcare wing, it may be that a specific area of the healthcare wing was set aside for people with COVID diagnoses, so that the people working with those prisoners are going to obviously be exposed to the virus, and the employers need to take steps to ensure that they are safe. The question really then is whether the employers have reduced the risk to the lowest reasonably practicable level. That's essentially the legal test under the Control of Substances Hazardous to Health regulations, which are likely to apply in that case. So that's the scenario where the employer knows that there is a risk. They have to do something about it because they have to care for those prisoners, but they have to ensure a reasonable level of safety for the workers who are entrusted with the care of those prisoners. In another scenario, the employer might not know that workers are being exposed to COVID, because they might not know that colleagues or prisoners or other people with whom you're coming into contact have got COVID. That might be reasonable. They might not have any grounds for knowing that. They might not have, especially early on, they might not have had any reason to believe that that was the case. But clearly that situation has changed over time, and now the question becomes, well, were they keeping abreast of that knowledge, or were they turning a blind eye to the fact that people may have had COVID, and therefore failing, because of that lack of knowledge, to put in place proper systems of safety for you. Now, we need to be looking at those issues and working out if the employers have worked out a proper risk assessment and then carried it out. But we also need to establish that members haven't been exposed elsewhere, and that therefore that other exposure might have been the cause. So for instance, how were people getting to work? Were they on public transport? Were they out socialising like normal? Were they out going to the supermarket? If they were they wearing a mask when they did that? And were they taking care outside of the workplace? We have other examples where people have brought the condition home from work. They've contracted it at work. We've certainly seen this in the health sector and social care, that people have worked in care homes and hospitals and have brought back the virus and infected their family members, a little bit like the situation where we saw people bringing asbestos home on overalls, and typically in those days the man would bring it home and a wife or children would be inhaling the asbestos, in the same way people may have contracted COVID and brought it home from work. So we've brought claims already for a number of POA members, and we're able to advise you and consider bringing claims for members in prisons, in the public or in the private sector, in secure psychiatric units, and for members in prisoner escort and custody services. Wherever you are, it's possible for us to advise. So we're adopting, I think, a cautious but progressive approach. So we're very mindful of the fact that the pandemic isn't over, and we're not being silly in the way that we conduct litigation. We're doing it in a sensible way, and if defendants, employers say, look, we need a bit more time, we have difficulty getting hold of records because of COVID restrictions and so on, when, as I say, we're being sensible and pragmatic about that. But we do think if there's been negligence, if there's been breach of duty by the employers, then workers are entitled to bring a claim. We're still awaiting responses for employers and insurers on many of these cases. We'll have to review those responses as and when we get them, but we will litigate where it's necessary and appropriate. We won't be litigating every case where people have got COVID, as I say, but if the person has contracted it because of the employer's negligence, they've unnecessarily contracted it and they've suffered injury and loss as a result, that's fine. We'll be more than happy to bring a claim in those circumstances. And the claims will be stronger where one of these factors applies. Firstly, that the employer has failed to provide any adequate PPE in the face of an obvious COVID risk. That the employer may have written a really sensible risk assessment, put in place lots of sensible measures, but then just hasn't followed through on that, and hasn't followed their own policy. That's really good evidence that might support a claim. And then finally, where there's been an outbreak of cases in the same establishment, and the employers have failed to adapt their regime or take other steps to keep the workplace reasonably safe, again, that might be ground for making a claim. So if any of those factors apply in your case or colleagues' cases, we would like to hear. So you can please contact us on 0800 5877 515 or on our website thompsons.law/start a claim. Either of those methods will come through. You can explain your POA membership and we can take matters forward. So we look forward to hearing from you. Thanks very much.